Hi, I'm Dr. Morgana Colombo, and I wanted to welcome you to our Ellacor virtual experience. My hope is to get you some insight into our newest skin tightening treatment, Ellacor. Hopefully take away some of the fear you may have when it comes to the Ellacor treatment. Just hopefully get you as excited as I am about the Ellacor. At the end of this webinar, we're going to be answering some live questions. So if you have any questions, feel free to, send us a questions through our question box, and a staff member is going to get back to you. We're also going to give away two $500 discount certificates on Ellacor treatments done at our office. So Ellacor is the newest skin tightening device in the market. It basically consists of hollow needles attached to suction that cut out little pieces of skin or little cores of skin, and that cutting or coring out of little pieces of skin leads to contraction and skin tightening. The cutting also leads to collagen stimulation, which further contributes to even more tightening. I brought Ellacor into the practice because I'm very interested in skin tightening and very, very excited about the results of Ellacor in the practices that have adapted from early on. So it's been in the market for a couple of years, and so far showing really great tightening results, superior to other devices in the market. For me, it just made sense that if you cut skin, you're gonna get tightening. I wasn't interested in surgical cutting with scarring and downtime. So this was particularly interesting to me because it's really non-invasive. There's really minimal downtime, no scarring, and you get to cut and contract skin that way. Ellacor is unique because it's the first non-invasive tightening device in the market that does not rely on heat for, skin tightening. So it's purely based on cutting. So you microcore the skin, you cut the skin, and that leads to tightening. But most importantly, cutting without scarring. So you can cut the skin and get tightening without scarring. And that's very unique about Ellacor and very exciting. It sort of gets us closer to surgical results without having to go through, the downtime, the pain, the scars, all involved in a surgical cutting procedure. So Ellacor is a great tightening treatment for anybody that wants tightening of lower face, if you want improvement in your jaw area, jowls, if you have little radial lines here that you want improved, perioral wrinkles or extra skin, if you want a non-surgical lip flip, good for neck, submental, can also be used for certain body parts like abdomen, knees, arms. So lots of uses for Ellacor, and anybody that wants tightening of any of those areas is a good candidate. All ages, really 35 to 80, I would say. If you're younger, you may need one treatment. If you're older, maybe 2 or 3 treatments spaced 2 to 3 months apart. Works for males, females, actually really great for male skin. Men usually don't want to go through a facelift because they tend to feel that they look unnatural after that. So Ellacor is a great way to tighten the skin without having that unnatural facelift look for men. Same goes for female. The only restriction is that at this point, we're only using it for skin types 1 through 3. It's being studied for darker skin types, but at this point, we're not able to treat those kinds of skin yet because we're waiting for results to make sure it's safe when it comes to discoloration. So really great treatment for a lot of different kinds of people that want skin tightening. So Ellacor is a great treatment for anyone, skin types 1 through 3, who is looking for lower face, specifically skin tightening. It's great for jowls, radial lines that really, for some people, are very bothersome. Good for perioral wrinkles, loose skin around the mouth. It's also good for neck, submental area. Can be used on body parts such as, abdomen, post, partum or post weight loss, extra skin on the knees, extra skin on the arms. So it really has a variety of uses when it comes to skin tightening, with the number one indication being lower face tightening. I'll mention that it can also be used in facelift patients that have loosened up the skin a little bit and don't want to go under the knife again. So it's a great way to sort of like refresh your tightening. It works well in males and females. Really great for males because it allows them to get a little bit of tightening without, the sometimes unnatural look that a surgical facelift can give to a male. So Ellacor is great for everybody that wants tightening, ages 35 to 80. Younger people need 1 treatment, older people need 2 or 3 treatments. You typically see results within 2 weeks. Peak results at around 2 to 3 months, which is the time it takes for collagen induction to take place and healing from the cutting. Most people require 2 to 3 treatments, spaced 2 to 3 months apart. And after that, maybe every 5 years, doing like a repeat series of treatments. So the downtime is typically 7 days. So for the first 3 days, you have little holes with little tiny scabs. Those holes seal or close at around 3 days. And then after that, you just have pink blotchiness that subsides at around 7 to 10 days. We tell people not to wear makeup for the first 3 days. After that, you can, cover things up with makeup. Which is, nice. One thing I wanted to point out is that the healing is totally painless. People tell us that if they don't look in the mirror, they wouldn't even know they did anything to their faces. So that's really nice. I'll also mention that the actual treatment is pretty painless also after we do anesthesia with, injections of lidocaine. Right, so today we're doing a consultation here on our lovely patient. She's in her 50s and she's concerned about a little bit of like lower face sagginess. It happens to, most people as they go through the aging process. As you age, you lose collagen, the skin just gets saggier. And it basically loses definition in the jaw area and you start to, noticing some jowling. So I discussed with our patient here the possibility of doing Ellacor to address her lower face laxity or sagginess. It's a great treatment really for anybody ages 35 to 80 that have lower face laxity or sagging of the skin, specifically people with skin types 1 through 3. So Anne here is an ideal candidate. She's fair skinned. She has just a little bit of sagginess, a little bit of jowling. She also has a little bit of like sagging of the neck and submental area. So Ellacor can be used in all those areas to improve collagen amount and give the skin a little bit more tightening. So as I see it, Anne would be a great candidate for lower face, Ellacor, submental, and neck. Cutting the skin would definitely lead to a little bit of like a tightening effect and improvement in all those areas. She would also get some improvement in the perioral lines and would get like a slight lip flip effect with doing Ellacor around the mouth. Nasolabial folds will also improve by doing Ellacor around it. So it's really like an excellent treatment for her. So Anne will probably need about 2 treatments, spaced 2 to 3 months apart, and then a repeat potentially in 5 years. So yeah, so Ellacor, great for, you know, early stages of sagging, can also work for later stages, but at that point you will need more treatments. And it can even work for younger patients that want just a little bit of tightening and more definition of the jaw area. And in that case, 1 treatment will do a lot. So, yeah, so that's it.
I recently had Ellacor treatment. I've had other treatments in the past, and they've had some positive results, but this is a very different experience. The actual procedure is much less irritating. The recovery time was much quicker also. I went back to work in 3 days. And I can see and feel a difference in my skin. It's tighter, smoother, and looks healthier.
I wanted to thank everyone that attended our Ellacor webinar tonight. It was great having you. I hope I was able to answer a lot of the questions you may have had about Ellacor and taken away some of the fear that you may have had when it comes to this new treatment. I'm a big fan of Ellacor. I think it's a great skin tightening treatment. For the giveaways, we're going to be emailing and calling the winners. So be on the lookout for that. And good night. Oh, hi everyone. I wanted to thank everybody who attended the webinar, and I'm going to take some questions now and answer. You know, I'm still in the office, so let me start here from the bottom of the questions I've gotten. One of the questions I'm getting here is Ellacor safe for all skin types, or are there restrictions? So like I tried to mention, maybe I wasn't very clear. So Ellacor at this time is indicated for skins 1 through 3. So that would be your, you know, of course, white skin. And then it can also be done on people that are olive, of like Hispanic background, not used at this point for, and then Asian skin will also fit under a type 2 or 3. So I wouldn't recommend it at this point for anybody who is African American, or Indian or Middle Eastern with darker skin tones. It just launched not too long ago in Dubai, the Middle East. So we're getting a lot more data on those skin types. So once we get that data, it will probably be incorporated in all skin types. The results so far are promising for all skin types. But at this time, we're only doing on 1, 2, and 3, which will be white, Asian, Hispanic, I guess light Middle Eastern, so lighter skin tones. Is it painful? So if we didn't numb you, it would be painful because it's, we're inserting needles on your skin. But we do a very extensive numbing process, which makes the procedure very, very painless. We first use a cream called BLT, which is a pretty strong in-office numbing cream. We numb you for 1 hour with that. And after that, we do lidocaine injections in the areas. So between the numbing cream and the injections, the pain is like barely any. It's almost like zero. I also have another question here. How soon will I see results? Will my results improve over time? So typically you do see an initial tightening effect within 2 weeks once you have that initial healing. The full effects are going to be 2 to 3 months after your treatment, once you have your collagen induction, which leads to more tightening. Like I mentioned also, so if you're young and you have just like a little bit of sagging, 1 treatment would be enough. If you are somebody who, So if you're somebody who has, so who's made, so like young, I mean like somebody who's 35, 40s, one treatment a lot of times will be enough. If you're somebody a little bit older, um, like let's say 60s or 70s, still an option for you, but you may just need more treatments. And that could be 2 or 3 treatments. We space the treatments 2 to 3 months apart. You could do them as soon as 1 month apart. Um, Here, I have a question about, are there any side effects associated with Ellacor, and what should I expect post-treatment? So that's a really good question, very pertinent. So really no side effects per se of the treatment. If you go online, you're going to see all sorts of things, that people have holes that don't close and all sorts of things. We really micro-core the skin, meaning we take out tiny little pieces of skin. Within 3 days, those little tiny holes, they're completely sealed, and you don't even see any holes anymore. You just see blotchy redness, very similar to like a regular microneedling treatment. That blotchy pinkness will last anywhere from 10 days to, on very fair skinned rosacea prone patients, could be a month. For people that have a little bit more redness, we actually do a follow-up at about 2 weeks post-treatment, and we run a vascular laser, and that makes a huge difference in the improvement of the redness. It really speeds up the resolution. If you do nothing, you still heal from the pinkness, and it's really subtle. You can totally hide that with makeup. We also recommend a healing ointment. It's called Elastin Skin Nectar, which I also recommend for other lasers, and that makes a huge difference when it comes to that post-treatment redness. So if you're scared of redness, definitely follow the recommendations. But really, by 1 month, most people are totally fine, especially if we do the laser. And we don't charge for the laser, it's just we do it as part of like the full treatment. Here I have another question about, do results differ by age? So everybody responds because you're basically cutting skin. We can modify the amount of skin that we cut. So you can cut 5%, 7%, 8% of skin. So of course, if you cut more, you get a little bit more tightening, but also a little bit more redness. So we usually kind of go in the middle. Younger people tend to have less loose skin, so with that, they have a bigger response with less treatments. With older people, of course, you have more lax skin, and the more lax skin, the more treatments you would need. On average, we say anywhere from 2 to 3 treatments for older people. Are you going to get like facelift like results? No, because they're cutting way more skin. But for somebody who doesn't want to go surgical and wants something easy with some good tightening, I think Ellacor is a good option. Also a good option for people that have had a facelift and the skin has loosened up a little bit. It gives you just a little bit of extra tightening post that procedure. And one other thing that I'll mention, if you have done, RF microneedling, CO2 laser, old therapy, other tightening treatments, Ellacor pairs really well with those. So those other treatments are all heat-based tightening treatments where you induce collagen by heating. Ellacor is not doing that. It cuts skin, so you're actually removing skin. And anytime you cut or induce any injury on the skin, you get scar tissue formation, collagen, which contributes to extra tightening. So it's complementary to the other treatments. And if you were to go head to head, maybe a little bit better because you're cutting skin. So here, I scar easily. Is that a problem? So it really does not lead to scarring. If you have any, if for people that are more sensitive and tend to scar easily, maybe you will be red for a little bit longer. If you have any marks that take a little bit longer to fade, we also have a device for that. So I talked about the vascular laser for redness. We can use our clear and brilliant or Fraxel laser to help with any significant marks that were to be left over, but it's very, very unusual for that to even be needed. Most people really just get blotchy pink and that fades completely by a month, but most people are looking pretty decent by 10 days. Um, and here, if people keep asking me about what are skin types 1 and 3, so skin type 1 is the one that, if you go out in the sun, you burn every time, very fair. 2, you're fair, but you can tan a little bit. 3 are the people that tan are more olive tone, like Hispanic skin, Asian skin, some Middle Easterns. And then 4, 5, and 6 are your African Americans, Indians, darker skin tones. And then before and after pictures and during recovery. So we had a few during the presentation, and I'll post on online on my website. But if you Google Ellacor, there are tons of before and afters. And after 2 to 3 treatments, it's not, like I said, it's not surgical facelift type tightening, but you do get noticeable tightening. I did. We got the machine maybe like over the summer, so 4 months ago. I did 2 treatments on my mom, and she's in her 70s, and she has done profound old therapy, lasers, all sorts of things. And she thought that the best tightening she's received so far from those non-invasive tighteners has been from Ellacor. She really thought that it made a nice difference. I mean, she's not super tight, and that's not what you're aiming for. You're aiming for, subtle improvement of jawline, jowls, really good for perioral lines, almost actually equivalent to CO2 laser when it comes to wrinkles around the mouth. How much does each session cost? So our usual cost for Ellacor is $3,000 per session, similar to other tightening devices. As our introductory cost now, we're offering $200 off. So we're at $2,800 a treatment for the next few months, November, December, probably January. Another one. So we ask about the cost. Can you use around the eyes? So at this point, we cannot use it around the eyes. It's really only indicated for lower face, around the mouth, under the chin, neck, and then some body parts. Works best for lower face. Here, another question. Is it possible to have the treatment without the lidocaine? So yes, you could probably tolerate it without the lidocaine. In that case, my recommendation would be to do the strong numbing cream and potentially the Pronox, which is inhaled nitrous oxide gas that we have, just so that you relax. Or, the same way we do the old therapy, which is the cream and a pain pill. So you could probably, it's really tiny little cuts. So I think you could tolerate with a pain pill and the numbing cream, but with the shots, you literally feel nothing if you're able to tolerate the shots. Does it help with sun damage? No. So Ellacor is strictly a tightening procedure. It does not do anything for sun damage. It basically just cuts extra skin and leads to skin tightening and improvement in wrinkles, which a lot of times are caused by extra skin. All right. So those are all really great questions. I hope you guys, are as excited as I am about Ellacor. I think it's a really great non-invasive way to tighten skin, a whole different new mechanism of action and different mechanism of action. So like I said, all the other devices, which are good, they're heat-based. This one is cutting, which, it makes sense that if you cut the little skin, you're going to get a little tightening. So great for people that have just a little bit of like subtle loose skin, younger people, or for people that have more loose skin and are willing to, have a few treatments, but, and don't want to go through like surgery, or have done the other devices and want a little kind of like tuning up for results. So really good treatment, ages wise, 35 to 80, so wide range, good for males, females, a lot of skin types. Right now, like I said, we're doing for fair skin and olive skin, but in the future, I think it's going to be pretty much everybody. Um, and so really great treatment. You see results, easy healing with the numbing that we do, easy treatment. Okay, you do look bad for like 3 days. So you can't do makeup for the first 3 days because, you have open little holes that have to seal. But after 3 days, you can do makeup, hide the discoloration. So I think it's a really good new option for people that are looking for tightening, which is a lot of people after the age of, like, I would say 40 for sure. Um, so I wanted to really thank everybody that attended. Remind you that we have a little special like the next few months where we're giving 200 off Ellacor treatment, so 2,800 instead of 3,000. Um, if you're interested, please let us know and we can contact you, or just call our office so we can, get you in. And you can book, or you can just come and talk to me again and we can see if it's a good option for you. But it's really a good option for most people. But if you're unsure of like your skin type, definitely, come and have a chat with me. We can discuss. Very excited about, doing more and more cases. And I think it offers a lot of promise. And who knows, maybe in the future they'll have like a little handpiece for the eyes, which would be great. Um, but I think it's a really good new treatment. It really kind of bridges the gap between the heat-based tighteners and surgery. So it's kind of the in-between thing. A good option for everybody. So I wanted to thank everybody and have a good evening. Thank you.